What is the biggest mistake in treating hypertension? A lot of people ask me whether certain pills are suitable or if they can take these or those pills. How do you properly choose the medication that will be most suitable for a person? I personally hold a different perspective and believe that the single most significant and detrimental mistake, the most profound and damaging harm that an individual suffering from hypertension could possibly commit is to merely self-prescribe pharmaceutical medication for continuous perpetual use for the remainder of their lives without a comprehensive and thorough understanding of the underlying etiology or root cause of their specific hypertensive condition. This is the greatest evil. I understand that this is exactly what our doctors do. They prescribe pills to patients with hypertension and tell them, you will be taking these pills for the rest of your life. But this is truly the biggest and most significant mistake in effectively treating chronic hypertension. When a person's blood pressure invariably rises, there is always a fundamental and underlying reason for it, a specific cause that needs to be identified and addressed. There aren't actually that many causes. It's either poorly functioning kidneys because they are inflamed, or it's because the kidneys can't cleanse the person with the amount of water they drink. It could be stress factors that affect the heart. It could be excess weight. It could be hormonal imbalances. However, there are often very specific and underlying reasons why an individual person experiences persistently high blood pressure. Indeed, the human body has meticulously created this elevated blood pressure for some particular and important reason or a specific underlying purpose. And the task of someone with hypertension is to determine the reason why their blood pressure has increased. By the way, it could be a combination of reasons. There could be several causes. And then these causes should be addressed one by one. But if a person with hypertension, with high blood pressure, simply starts taking pills and uses these pills to symptomatically lower their blood pressure, they are actually doing the worst thing possible. First of all, the pills themselves will start to cause destruction and damage to our body, to various organs. There are pills that will damage the heart. There are pills that will damage the kidneys. There are pills that will affect blood rheology. There are pills that will harm the brain. And a person who constantly takes these pills will be harming themselves. Of course, a single pill will not cause any major changes in the body or do significant harm. But keep in mind that people take these drugs, this poison, for a long time, constantly, every day. In that case, the toxic effect from taking this medication will be such that it causes damage to certain parts of the body and some organs. This is the first harm a person does to themselves. The second thing that happens is that the root cause of the illness is not addressed. And since the cause is not eliminated, it continues to cause damage. It keeps causing high blood pressure, and over time, the body adapts to the effects of the medication, and eventually, they stop working. And high blood pressure can negatively affect the condition of the vascular walls. And because the vascular wall may rupture, there can be bleeding into the brain, a hemorrhagic stroke. In that case, the person will simply die. Or constant high blood pressure can lead to continuous pressure on the vascular wall. As a result of this pressure, the vascular wall becomes thick, and it is through this vascular wall that blood supply occurs. The supply of blood, nutrients, oxygen, and the cleansing of all internal organs. And such thickening of the vascular walls reduces nourishment, which in turn, over time, causes organ atrophy, leads to organ hypertrophy, and causes organ hypoxia. That is, constantly high blood pressure leads to disorders and destruction of internal organs. For example, high blood pressure leads to atrophy of the cerebral cortex and the development of dementia, as well as the development of dyscirculatory encephalopathy, a disruption of blood supply to the brain, but not acute like a stroke, rather chronic. And if a person simply takes pills, just lowers their blood pressure, their body continues to deteriorate because the root cause of the disease is not addressed. In this case, the person is actually doing the worst thing possible. They are killing their body twice. First, by not eliminating the cause of the disease. And second, by taking toxic chemicals, pills, for a long time, which supposedly lower hypertension. So what should you do instead? Next, guys, in order to do everything correctly, you need to understand two things. First and most importantly, you should never mindlessly take blood pressure lowering pills if you haven't identified the cause of your hypertension. By taking these pills, you are only addressing the problem symptomatically, but you are not eliminating the root cause of the disease. That's why you shouldn't just blindly agree to take medication for lowering blood pressure for the rest of your life. Second, you need to find out the reason why your blood pressure is elevated and address that cause. For example, if you discover or determine that your high blood pressure is due to the fact that you have 30 extra kilograms, you weigh 150 kilograms, but you should weigh not 150 kilograms, but a bit less after all. Then the question arises about reducing the person's weight. Various methods are selected for how this can be done. But if you just take medication without losing weight, that's a road to nowhere. By doing this, we only harm our kidneys, harm our heart, and eventually cause their destruction. If you find that the cause of high blood pressure is that the person doesn't drink enough water, that is, normally a person should drink 1 liter of water for every 30 kilograms of body weight, but someone who weighs 100 kilograms drinks only 1 liter. Instead of 3 or 3.5 liters, just 1 liter. And then they develop hypertension. Yes, they take pills to lower their blood pressure, but without water, without drinking enough water, there is a global disruption throughout the entire body. The person dries out, their brain dries out, and that's a problem. This problem is the slow destruction of the nervous system, which will lead to dementia. That's why it's necessary to normalize, to determine your own water intake and establish a proper drinking regimen. And not all liquids count here, only the water that a person actually drinks is included. For example, a person discovers that because they have a heart problem, an issue with the nervous system of the heart, like tachycardia, episodes of arrhythmia, or even the appearance of extrasystoles, arrhythmic conditions in the heart causes the person to have high blood pressure. In this case, therapeutic measures should be directed not just at lowering the blood pressure, but at acting directly on the heart. That means you need to eliminate the stress factors that cause this overload of the heart. You need to determine why there is such tachycardia, what caused the heart to start working so hard and so fast, and then accordingly eliminate this cause. So from the very beginning, when treating hypertension, you should always follow the principle that simply taking blood pressure pills is a great evil. If we don't eliminate the cause of high blood pressure, we risk not only failing to achieve good overall health, but also significantly worsening the condition of our body's key organs, such as the heart, blood vessels, kidneys, and so on, by taking medications. That's why you should never agree to simply being prescribed pills or to the constant switching of one medication for another, and then another, and so on. You need to eliminate the cause of the illness. First and foremost, if you remove the cause of the illness, there is a chance that you can cure your hypertension. That's the information I wanted to share.